World War II was over, and America had helped save the world from tyranny. But for those coming home with spinal cord injuries, their world was full of doubt and uncertainty. Prior to World War II, a spinal cord injury or disease had been a death sentence. But with good medical care, a spinal cord injured veteran could and would live a full lifespan. These young men realized they were not just disabled wheelchair bodies, but men still full of vitality, aspirations, potential, and vision. They could live a full life, and they would.
Once we found out we were not going to walk, we were not going to stand still, we were going to get out there and make a life for ourselves and not be shut-ins. And that's the first thing we thought of. Let's go down Broadway, 42nd Street, any place. Let's get out in a wheelchair to people that have never seen wheelchairs before. And it was great.
Basketball was what first got the paralyzed veterans together. On the court, they got to know each other and bond with each other and become a team. PVA emerged from these early basketball encounters and eventually grew to become the organization that it is today, even developing its own magazine, Paraplegic News, or PN, which published its first issue in July 1946. Now in its 75th year, PN has a worldwide readership of 90,000. PVA's other publication, Sports and Spokes, was published in 1976 and focuses exclusively on adaptive sports.
It became obvious when, after a few months of laying around, that the Army was going to do nothing but discharge us. And there we were going to be, just a bunch of veterans, has-been.
The whole goal of PVA was not to live life in a hospital, but to live life as close to what life could be like for someone who didn't have a spinal cord injury.
Whatever we needed, we were going to have to get ourselves. We're going to have to learn and fight for what we wanted. And that's what we've been doing all these years.
Their new battleground would no longer be on the fields of distant lands, but in the hallowed halls of Congress, the sometimes inaccessible nation's courtrooms, and the hearts and minds of the American people. In December 1946, an article appeared at a New York newspaper outlining the desperate need for suitable housing. It was part of a carefully orchestrated campaign to get Washington to act. On June 19, 1948, Public Law 702 was signed by President Harry Truman, authorizing federally funded housing for paralyzed veterans.
By the 1960s, I would say, there was beginning to become a recognition, a realization that this society had excluded over 40 million Americans based on their disabilities. And the first real step in doing that was the passage of the Architectural Barriers Act in 1968. And that basically said that when the federal government built something, it had to be built accessible to the needs of people with disabilities.
When Washington, D.C. decided to build its metro system, its design was not friendly to wheelchair users. So PVA, along with other organizations, sued the metro. The court ruled against PVA, stating the act did not apply in this case, but the judge also wrote,
PVA's had a reasoned voice in this entire process, and time after time after time, the recommendations have proved out to be right. Why don't we just put them in charge of making sure that it's barrier-free?
And now, thanks to PVA, there are elevators at every Washington, D.C. metro station. In the 1980s, PVA hired its first on-staff architect and shortly after went on to form a full staff of licensed architects. PVA's architects work directly with the Department of Veterans Affairs throughout the design and construction of spinal cord injury centers. Beyond its work with the VA, PVA's architecture team serves as subject matter experts for large public projects, including the 1996 Olympics, where they ensured sports venues and housing complexes were accessible for both athletes and spectators, the National World War II Memorial, Nationals Baseball Park, the Disabled Veterans for Life Memorial, Minnesota Vikings Stadium, and the JFK Center for the Performing Arts expansion. PVA architects are also published authors with their first book, Design for Hospitality, published in 1988, and their Accessible Home Design book, published in 1998, which remains popular, going into its third print edition. The 1960s also brought a new war and a new class of spinal cord injured veterans. At the height of the Vietnam War, thousands of spinal cord injured veterans would come home to a VA of old, deplorably outdated buildings. Once again, PVA would turn to the media to push the public and Congress to do what's right for our veterans.
The original building was built right after the Civil War, if I remember correctly. And somebody came in and they asked us questions about the VA hospitals and everything. And they went up there dressed up in their suits and with clipboards, and they were taking notes and everything to the hospital, taking pictures. And I guess nobody challenged them for a while. Then all of a sudden somebody got a little nervous and asked them who they were. And they said, "We're from Life magazine." And when that came out, all hell broke loose.
The expose had the desired effect, and PVA was called to Washington to testify before an embarrassed Congress and Veterans Administration.
One of the first things I told them was that we wanted new spinal cord centers. We needed them.
And they got them. And today there are 25 SCID centers across the country.
It's one of the reasons why PVA exists, is to make sure that our members receive quality care at the VA system. And we can look to the establishment of these spinal cord centers, I think, is just a major achievement.
The newest SCID center opened in 2019 in Denver, thanks to the advocacy over a 20-year span in which PVA worked alongside the VA to make the new medical center a reality.
It's important for the VA to see that they needed an SCI center in Denver and a whole facility here, and done right for veterans of all abilities, all disabilities, all eras. It is so important for them to have this right at their fingertips, the state-of-the-art facility. Our nation's heroes deserve no less than that.
Despite the challenges PVA faced during the pandemic in 2020, PVA's work carried on, and this year construction will begin on the new SCID center in San Diego.
The spinal cord injury system of care in the VA is one of the crown jewels of its healthcare system. It's really unlike anything that exists in the broader healthcare system in America. Our members rely on it for almost all of their care because they can't go to the community and get the kind of complex, multifaceted care that they get from the SCI system of care.
Since its beginning, PVA sought congressional recognition to better serve its members. Denied for years, PVA was finally awarded its congressional charter in 1971. And with this charter came an invitation to testify before the House and Senate on veterans issues. Now PVA could have its voice heard. Each spring, PVA's national president testifies before a joint session of the House and Senate Veterans Affairs Committees on its top veterans legislative priorities. And throughout the year, PVA provides testimony on a variety of issues that affect the healthcare and benefits of veterans with SCID and the civil rights of all people with disabilities.
We believe there are two significant problems that remain with this bill, even if it is enacted. First and foremost, we believe that reproductive services should absolutely be part of the medical benefits package of the Department of Veterans Affairs.
The charter also gave PVA the legal right to represent veterans in their claims for VA benefits, all the way to the Court of Veterans' Appeals if necessary. Today, Veterans Benefits is PVA's largest department, with 75 service offices nationwide. PVA National Service Officers specialize in providing services for veterans who are severely injured or suffering disabling diseases. And they do all of this free of charge.
I always tell people we're counselors, we're social workers, we're advocates, we're friends. We're people that you can depend on, and we just don't help them fill out applications or send something off to the VA to be granted. There's a lot. I go to funerals, I go to hospitals, and that's a good comforting feeling to know that we are part of that. I'm a part of that.
When a veteran's benefits or medical claims have been denied by local VA facilities for issues such as effective date of benefit awards, mortgage insurance, or other reasons, veterans can turn to PVA's appellate services. This legal team works directly with service officers and veterans to obtain all evidence possible and present written and/or oral argument before the Board of Veterans' Appeals. In the 1980s, PVA established a strong presence in Washington, D.C. PVA became a powerful voice for spinal cord injured veterans and used its voice to change the chronic underfunding of the VA. PVA created a budget by veterans for veterans, and it was called the Independent Budget.
Nobody shows greater indignation than the Paralyzed Veterans of America, who wrote the speaker saying, "We do not consider payments to war-disabled veterans."
Every year it has put together this independent budget, which I think makes the case for what veterans need.
For 35 years, Paralyzed Veterans of America has been working along with our partners, DAV and the Veterans of Foreign Wars of the United States, to develop and present recommendations that will ensure that the U.S. Department of Veterans Affairs is fully funded.
As airline travel became easier for Americans in the 1980s, paralyzed veterans were often denied boarding and made to bring an attendant. PVA had had enough and sued the federal government to force the air carriers to not discriminate against people with disabilities. The Supreme Court said, no, you are not specifically covered by this law, but the court recommended we ask Congress to change the law.
And in less than 3 months, PVA, pulling some other folks together, but primarily PVA, secured the passage up in Congress of the Air Carrier Access Act that Ronald Reagan signed into law, and it was the first non-discrimination law to benefit people with disabilities.
PVA continues to be a leader in working to ensure that air travel is accessible to all people with disabilities. From the lack of seating accommodations, poorly trained assistants, broken wheelchairs, and lack of enforcement of the existing laws, it can be very difficult for paralyzed veterans to be able to travel, as well as other people with disabilities.
In 2020, PVA celebrated the 30th anniversary of the Americans with Disabilities Act, a sweeping civil rights law signed by President George H.W. Bush that prohibits discrimination against individuals with disabilities. PVA led the charge for passage of this legislation, which is regarded as the nation's most comprehensive law affecting people with disabilities. PVA continues to fight against efforts to weaken the ADA.
We want to make sure that when people with disabilities come to your stores, come to those parks, get on the city bus, that they find the accommodations that allow them to participate just like everyone else.
The VA Mission Act of 2018 made important reforms to the Department of Veterans Affairs that will help to ensure that it's able to continue to serve veterans for decades. From the beginning, sports and exercise have been a very important part of spinal cord injury rehabilitation. So in 1985, PVA joined with the VA as co-host of the National Veterans Wheelchair Games. The value of the games and adaptive sports to this day goes far beyond physical health. In July 2018, PVA and VA celebrated their biggest milestone to date, hosting 611 veterans, its largest attendance ever, at the 38th National Veterans Wheelchair Games in Orlando, Florida.
The awareness of PVA got me involved in the wheelchair games and fishing and hunting and a lot of other sports that I probably wouldn't have known about if it hadn't been for Paralyzed Veterans of America.
PVA's adaptive sports and recreation program is more than just competition. Throughout its history, it has helped to inspire others, engage communities, and more importantly, create awareness about who we are and what we do as an organization. And over the last year, we rose to the occasion, hosting meaningful programs when PVA members needed to be connected, more than ever. And through these programs, we were able to reach veterans across the nation and sometimes even globally, and connect them with peers that brought a positive influence to their lives during a time of uncertainty. As we look to the future, we look forward to building an adaptive sports and recreation program that positively impacts the quality of life of all veterans and continues to encourage them to live a healthy and active lifestyle.
In 1974, PVA established foundations that improved the care and treatment of spinal cord injury and dysfunction, and it has paid off in countless ways, such as major advancements in cushion and wheelchair design, and improved education for both clinicians and lay people.
Research and education program at PVA is small but mighty. Through our foundations, our clinical practice guidelines, our healthcare summit and expo, we bring together the best and brightest minds in spinal cord injury, MS, and ALS research and treatment to conduct studies and educate providers to ultimately improve the lives not only of our members, but others living with spinal cord injury.
To date, PVA has contributed over $61 million to research and education around spinal cord injury, MS, and ALS. There's no substitute for good health care, and for veterans with spinal cord injury and diseases like MS or ALS, quality health care is imperative. For the past 37 years, PVA's medical services team has partnered with the VA and been granted exclusive access to its SCID system to ensure the VA provides quality specialized care.
We are a team of doctors and nurses, and every year we perform annual site visits to the SCID hubs. So we're able to go in with a physician, with a nurse, an architect, and then a member and have an assessment of each of the facilities to make sure that they're meeting certain metrics, national standards for quality of care, nursing care, physician services, therapy services, telehealth services. We really look at the whole aspect of care.
After each visit, these findings, along with PVA's recommendations, are then incorporated into a site survey report and submitted to the Secretary of the Department of Veterans Affairs. Launched in 2007, PVA's Veterans Career Program offers high-touch, one-on-one support to the veteran community to help them find meaningful employment, education, or volunteer opportunities. The program assists with everything from resume development to instilling the confidence that is necessary in the job search.
The crux of our program, the foundation, is that we're going to help these individuals with significant disabilities, such as a spinal cord injury, really help them address any fears they have about their disability in the workplace. We really want to make sure that we're starting these people off, these veterans off, on the right foot, so they can move from and progress through something.
With a renewed focus on serving women veterans and addressing specific issues they face, PVA's Anita Bloom Veterans Health Committee, named after PVA's first female member in 1947, was officially established at the 2019 annual convention in Aurora, Colorado. Later that same year, PVA kicked off its first Women's Veteran Empowerment Retreat, which brought together 40 women for 3 days of learning, networking, and relaxing. This event would be one of PVA's last large in-person events before the novel coronavirus would make its appearance in the U.S., shutting down much of the country and halting all in-person gatherings. Operating more than 70 offices and 33 chapters across the country, including the District of Columbia and Puerto Rico, PVA helps paralyzed veterans, their families, and caregivers live full and productive lives.
It's up to us to provide opportunities and to create opportunities to improve their life through the programs that we run. You know, whether it's sports, whether it's politics, arts, getting a job, going back to school. Those opportunities are out there for our members. And it's up to us as a collective group, or being staff and leadership, to expand those opportunities through our donors and our corporate sponsors. Because ultimately, we have to get the resources and the funding to run our programs and hopefully expand them. I think I'm most proud that the last couple of years, I've received feedback from members that they feel stakeholders of this organization, and that this organization has provided programs and opportunities that have improved their life. And that's all you can ask. I try to live by a Latin phrase called alias pro ego, which loosely translated means putting others before self. It's something that past President Jack Michaels taught me. I try to live up to that the best I can.
And while a pandemic raged around the world, PVA remained steadfast in its mission. PVA chapters across the country stepped up, redirecting funds from canceled events to assist members with things like grocery delivery and medical supplies. PVA's medical services staff and national service officers across the country worked closely with VA spinal cord injury centers to ensure our members still had access to vital healthcare services and medical supplies, while our government relations staff ensured veterans and their needs were not forgotten as COVID-19 stimulus funding was passed.
I don't think any of us could have imagined that as we approach our 75th anniversary, that this would have been one of the hardest years that PVA has ever had to go through with the global pandemic that started in 2020. And yet we learned to adapt, and rather quickly, because our members have needs that have to be met. We found ways to engage with our members through a lot more open communications, through webinars, to talk about all the different issues that they're facing and how we can continue to advocate for their needs in spite of the world seemingly being locked down. Our impact is seen and felt in so many different places and by so many people, and yet there's still more that we can do. But there's a lot more that we can continue to do. It's an exciting time for PVA. There are a lot of great things ahead, and we look forward to what comes after the 75th anniversary and how we can make a difference in people's lives.